All right, 5:33 and you're live.
All right, I guess we will call this first Community Wellness Committee to order. And so Councilmember Murphy.
Present.
And I'm here, Councilmember Davies, and I think that is at this point, the two members of this committee. I think tonight for this inaugural meeting here, I'd like to just have Mayor Drenick speak to his thoughts about this particular committee, a little bit more about what our goal and purpose is. I'm certainly very interested in hearing from the chiefs and from Dr. Georgeson in terms of, what are some of the thoughts as well, and maybe then we can kind of begin to craft out a little bit of a kind of a vision for where we're going to go and an agenda for the next couple of meetings. So, Mayor Drenick, if you would, I'd like to hear your thoughts.
Sure. Thank you, Mark. So the thought is that we have any number of agencies and various bits of infrastructure in place to address the wellness of our community. But my sense of it is that as a city, we can do more to be both coordinating and progressively planning for the mitigation of issues that we know that we have and the preparation for issues that may present themselves. So that's a long way around saying that if you know Oneonta at all, you are aware that we have a homeless problem of some concern. That we have mental health issues and we have addiction issues that quite often will present themselves, but more often are something that we discover after the fact of some other instance bringing us to that knowledge. We also have, obviously, we're all on this Zoom call unmasked because if we were all together, we'd all be wearing masks as a mitigation effort to try to stop that spread of COVID. COVID will apparently be with us for a little while longer, and there may be things that follow, and it would be wise for us to have some sort of strategy in place so that we're not reactive to it, but we have some sort of proactive strategy in place. Beyond that, my sense of it is that what you guys do is totally up to you. My sense of it is that there are resources that we know most of them. We may need to be actively engaged in some fashion in collecting them for the benefit of this committee and for the public. But generally speaking, where you want to go with this committee and what this committee may do in terms of bringing actionable items to council, I will leave to you.
Any questions for Mayor Drenick?
Good.
So one question I had for you then, Mayor, is do you see this also dealing with some kind of ad hoc type of issues or issues that might come up within the community that aren't even on our radar now? Localized issues within particular areas of the city that might have to do with general kind of wellness and general thoughts about how people live? Or do you see this really kind of focused on these bigger issues and not getting into the weeds in particular areas?
Yeah, I'll tell you quite honestly, Mark, my thought is to provide a venue for you all, including Emily as she joins the group by your next meeting, to be exploring the best use of your time and what can we get done. And if something suggests itself that isn't something that I've put out here in my rough outline, and the committee feels that this is something that should be pursued and that there's potentially something that we can bring forward as a potential solution to an issue, then yes, then absolutely yes. But it's your call. Honestly, it's your call.
You spoke about resources. Chief Witzenberg, in terms of some of the kind of addiction, mental health issues, are there any reports that you might be aware of that you've seen come through your office that might help us get a little understanding of some of the issues and problems rather than just anecdotal knowledge?
I could probably run off some reports. We do reports on all overdose calls that we go on. The fire department may also have some ability to pull up numbers in that regard. I'm actually rather surprised at the, I don't want to say underwhelming numbers, because anytime you have addiction problems and overdoses, there's a problem. But I've been surprised at how few we've had, especially fatalities that we've had over the last 2 years. I think I can speak to the fact that there's many factors that go into that, including the prevalence and availability of Narcan. The proximity to hospitals, better education. That's just one very small part of the greater picture that we deal with on a daily basis.
And I guess question for both of you chiefs, what is your understanding of the homeless situation in terms of, again, are there any reports? Just trying to understand what might be out there that are kind of to inform us more than, they're certainly recognizing there's other community resources, but just wondering if you both have any kind of knowledge about other reports that have been done that might help inform us.
The homeless issue is difficult for us to really put a finger on. I think we'd probably be better served trying to approach Catholic Charities and potentially social services for the county to see where we're at as far as numbers that they may have been assisting. The lieutenant and I actually encountered 3 people in the walkway today that we sat and had a discussion with to try to get them services and arrange for them to obtain services to get housing. And one of them is Adam, and he's been homeless for 17 years, that he's fine on his own. The other one's been 7 years in the city that we know of, neither one of which want anything to do with any services at all. And every time they're approached, they shoo us away. I expect that problem is going to become more severe with the warming shelter that we have here. We have more stories coming in daily of people coming from other places within the county, and sometimes even outside of the county, because we have access to services that they don't have in other areas. So we're seeing a bit of an uptick in population simply because of the services that we have available here in Oneonta. As far as what the exact numbers are, I couldn't even begin to guess. I do remember a conversation that we had with Eve Bobolas, who's the social services coordinator for the county. And the warming shelter, when it opened last year, I think it serviced about 40 people total. And I think we're up over 500 people already for 2021. I think it might even be higher than that. And I don't know what the numbers are for 2022. Obviously, we're only a couple of days in.
Wow, thanks, Chief. Chief Knapp, anything to add to any of that, or not to put you on the spot? I'm just trying to understand what we might have out there.
Yeah, I don't really have anything statistic wise. Like, I mean, I can run numbers as far as overdoses for like a call type. As far as the homeless, we're kind of in the same boat, unless someone tells us that they're homeless. Like, that's not something that we keep as a record. Typically, they'll try and give us some sort of address or PO box, because if we're dealing with them, they're a lot of times embarrassed about their status, so they will kind of sidestep the topic. So, but we definitely are seeing an uptick in, also, I would say, EMS calls at the homeless shelter, because these are people that are coming from all over, as Chief Witzenberg stated, and they have medical needs that aren't being taken care of. And so we're definitely hanging out there. I would say at least once or twice a week, we're heading over there for a call.
Okay. And
So
Dr.
just-
Jordan, go ahead. I'm sorry, Chief.
I just want to kind of paint a picture of where we are right now as far as there's many facets of legislation that have changed, and we had for a very long period of time people that would become incarcerated for the winter months that would count on county jails as being a potential place to domicile for the colder weather. That's been taken off the table for many. We have seen a market increase in mental health commitments with no availability of mental health services, which is a state and national problem. I ran the numbers for last August. I ran 3 months worth of numbers and basically came up with the 3 months that we had from basically June to August. I think we had double the number of total mental health commitments than we did the previous year. So the numbers of contacts that we're having with people in crisis have skyrocketed. We've worked and been working with Otsego County Department of Mental Health, with the Mobile Crisis Assessment Team, with SPOA, which is single point of access, to direct as many resources as we possibly can towards the problem. But there are no beds available anywhere. There's no long-term care for mental health treatment anywhere. There's no avenue to address addiction as a mental health issue. So we can't take somebody that's in crisis, that's addicted to drugs, and provide them with any help, because mental health requires that they be sober for a period of time. So we have literally been hamstrung at every level for our ability to be able to get anybody any help. And it's gotten to the point where we've gone and tried to get attention from judges so that we can get people incarcerated to get them additional treatment. We have one individual that we dealt with from, I want to say, roughly June up until last month. And when the weather started getting colder, he was being arrested and held in our jail cells overnight so we could give him dinner and breakfast in the morning, because we had no avenue to get him off the street. He would stay someplace until we would arrest him. If we let him go, he would be back at it again. Finally, we ended up approaching the court. He was remanded. It's just a very, it's an impossible situation that we're in right now, and we really just don't have any idea of a solution being apparent. There's no light even at the end of the tunnel at this point.
So Chief, this is all new to me, so my apologies for perhaps what are basic questions, but I mean, you're describing a pretty dire situation. It sounds like this is, not only do we have problems here at the city level, kind of being able to support folks, but it sounds like a county level and maybe even state level as well. Is that the case?
Speaking from conversations that we've had directly with people from Bassett Hospital, they don't have the facilities to be able to house people. They only have, I think, 12 beds in their adult inpatient psychiatric unit. They can't service kids at all. There was one child, and obviously I can't speak to names or anything, but basically spent like hundreds of days in limbo because they couldn't get legal process done, essentially. And there's just no avenue for assistance. There's no beds that exist. They're getting phone calls from out of state hospitals asking if they have beds in state. So Vermont, New Hampshire, New Jersey, in some cases, they're calling to find adult inpatient psychiatric beds at hospitals, and they're not available. They don't exist. Bail reform essentially shut down our largest provider of mental health services in the state, and that was the county jails. Now, I'm not saying that's an appropriate place for people to be getting help, but there's no mechanism for us to get people any help in the public.
And I mean, is this because it's not being funded at the state level or federal level? I mean, these lack of beds with such a kind of dire situation here, why don't we have more beds and more opportunities for people?
A moneymaker for the hospitals. Like Fox Hospital used to have a crisis center right in the emergency department, and then from there, like Fox Hospital was a central hub. Everyone would come there to get their diagnosis, and then they would be sent off to a facility like Bassett that had the inpatient bed that would hold them. But it just wasn't making money, and Fox decided it's something that absolutely had to be cut to help keep the doors open. And it's, I think, true across New York State is that there's just not the funding for it, and they're not recouping their money, so it's something they have to give up to try and keep the doors open.
Yeah, Fox Hospital did have an active inpatient unit up until, I don't know, 5-10 years ago. And all of that, I think, was, as Brian indicates, probably driven by economics, but also by the whole, taking over of Bassett. We lost lots of services in this community, but I think that was a true loss. And I think that mental health is such a complex issue that I totally agree needs to be addressed, and it impacts so many other things: homelessness, addiction, domestic violence. I think that, I don't think we're going to solve the problem in this committee, but if we can at least, maybe we'll have some ideas to find resources for our community members.
One of the things, oh, go ahead. I'm sorry, Mr. Mayor, go ahead.
No. So what I was going to say was, and Dr. Jorgensen, you're right. We're not going to solve it in this committee by any means, but there may be some things that come out of this committee that provide me with some direction in terms of conversations that I might need to have regionally and even on a statewide level. It sounds to me like, Chris, what you were saying, one of the things that I caught was just how busy the warming shelter is now, with how many more people than we have any reasonable expectation based on its past usage seeing. And that's an indicator of the fact that there isn't anybody addressing this issue outside of Oneonta regionally. And so people are finding their way into Oneonta, which then, for all of the good that we're trying to do there, obviously opens up the potential for making our issues even greater, frankly, than they were before, in that we are now essentially looking at a larger population to try to take care of, and we don't clearly have the means to do that. So part of this is going to be you providing me with some instruction as it becomes clear for conversations that I have to have. And part of this may very well be that we, as you did, Chris, with your community, what's the name of your committee? Your
Community Solutions Panel.
There you go, Community Solutions Panel, where we bring in players like Catholic Charities and various social services and Fordu and others to brainstorm with their connections ways for us to make small improvements in this situation. Clearly, this is a big one to try to put our arms around, and certainly shouldn't have an expectation that 2, and with the addition of Emily, 3 council members are going to solve the problem.
Yeah, I agree, Mr. Mayor, and I think that you make a good point. If anything, this could be a valuable place for us to exchange some information in regard to what the problems are and how they might be approached. What I was going to mention is that, through the Solutions Panel, we've had some pretty fair successes in managing some of the people that we've had in the public, but sadly, it comes back to seemingly the court has been our most effective and efficient means of finding people safe housing for a period of time until we can get them more intensive help. And that's where, like SPOA, for instance, single point of access, who work within the county jail system, and also with social workers that work in the county jail system, are able to connect with people that need those services long term. I don't think that we're going to have solutions to all these problems, but I'm always willing to have discussions in regard to what it is that we're looking at as a community.
Doctor, I think you were going to say something.
Oh, question. So to what degree, if any, will this group engage community partners? And I say that because the other day when I was out and about, I ran into Jeff Joyner, and I knew that when he came to town a few years ago as the CEO of Fox, he was very interested in community health and solving sort of systematic problems that, that were really more fundamental to the community than just, people in the hospital. So I think if we were going to reach out to community partners, having him or his representative, or a representative as choice, maybe that could be a resource we could use. He even mentioned that in Sydney, because now he's not just CEO of Fox, he's like the whole southern region of Bassett, which includes Sydney. They had, I think, done something with food insecurity there that he was very proud of. So, so that's really my question, and also just an offering that if you want me to be the liaison to the people at the Fox or Bassett systems, I'm happy to do that.
If I could to respond to that, in my thinking, this is something where, I'm certainly a member of this community, but this is something I don't know a whole lot about. So I think anytime we're able to get experts here to advise us, to give us direction, give us thoughts and ideas, it helps us to do what we need to do here, which seems to be think about whether we can create some local solutions, or as Mayor Drenick talked about, maybe inform him so he can be able to advocate at a county or state level. So in my thinking, if we're able to have these active partnerships with folks, that they're kind of taking on an active advisory role, perhaps attending meetings when needed, or perhaps even regularly, in my thinking, that does nothing but help us as a community to think about our charge and to think seriously about what we might do to push forward and try to come up with some solutions. So I would certainly welcome their involvement. That's the short way of saying that. Chief Witzenberg, if I could ask this question, again, this is perhaps my own ignorance on the topic, but I remember there was quite a bit of conversation a few years back about particular folks who were addicted and how we would respond to some of those addiction issues. And I'm sorry, that's all I remember is that we were trying, I think there was some thoughts about trying something novel in terms of our approach to dealing with folks that were addicted and were finding themselves in a situation where they might be arrested. Am I misremembering that, or have we taken as a county kind of a novel approach that's also part of how you handle policing in those particular areas, or where is that at?
Well, I mean, there's diversion courts now, but sadly, again, this goes to really have no way to provide a sober place to someone that doesn't want to be sober. So, again, this turns to the bail issue. Drug addiction is looked at as a hindrance to, and I'm not an expert in this field, so understand that I'm speaking in regard to a lot of the things that I've heard from other people. But drug addiction stands in the way of mental health treatment, because people need to be sober for a period of time before they start in with their mental health treatments. There's not really an avenue for us where we can say we have a person that's in mental crisis, that's having a mental health crisis, that's a threat to themselves, we can then bring them to a hospital for an evaluation. We cannot do that when it comes to addiction issues. We can simply arrest someone for, let's say, appearing in public for under the influence of a substance other than alcohol, but we can't hold them beyond them being sober, at which point we could refer them to mental health services, but don't have much luck with that given the state of most people when they're released from our care and custody.
Thank you. And just to double back, Doctor, to something you said, I'm sorry, I'm jumping all over the place here. A lot of thoughts as I'm trying to pull this together was you mentioned Jeff Joyner and his program of food insecurity. I mean, to me, that seems like that might be present in a lot of these different situations, whether we're talking about homelessness or whether we're talking about mental health, that, you know, folks might be food insecure for those reasons. But then we also know that people are very food insecure for other reasons, right? And poverty and job loss and things like this might certainly impact that. That to me seems like something we as a committee might want to also think about in the scope of our thinking, how we address food insecurity and how we think about food insecurity within our own community. And certainly I recognize that there are plenty of different groups working on all these different issues that we're certainly going to have to liaison with and partner with and consult. But it seems like that's something that we should be addressing as well.
So when I named this committee, you know, I struggled with the name of this committee, and you hit on it, Mark. Wellness as opposed to health. It seems like, you know, one is the same as the other, but it's really wellness is so inclusive of so many things, and food insecurity and even poverty. I mean, you can make a case, you know, for what, you know, what's healthy and what's, you know, what's well and what's not well. There are, I would imagine, Luke, I know you are, you know, the computer guy. Look at the headphones. There may be some research that might be done. I would suggest as to what some other communities have done with some success. There may be some best practices out there around, you know, addressing any of these issues uniquely or collectively. And I feel like, along with, you know, kind of determining what our current resources are, I mean, I think the chiefs both kind of address not only, you know, the resources that we bring to bear, but also the number of challenges that go with each action taken on the part of the police and fire department in interacting with folks that need assistances, whether it's they are reluctant or there are just not, you know, beds for people or you know, caregivers at any given level. All of those various things are hurdles that, you know, are daunting. My sense of it is probably there has been some success somewhere, and we may do ourselves some favors by maybe identifying what some of those best practices might be. And again, also determining, you know, what it is that we have, not just in the city, but in the areas surrounding us, so that if we are becoming a magnet for people who need help, which sounds like is the case with the warming shelter, that you know, it may well need to be a conversation that's had with surrounding communities, so that we are addressing this, you know, more holistically than addressing it ourselves and then dealing with the repercussions of our own, you know, good work.
Yeah, thank you, Mayor. And it seems like I'm been hoping to kind of use this meeting to get a little bit of direction. I think you point to it. I'm seeing one, we need to understand this context. Or I certainly need to understand it. We'll speak for myself rather than for the entire committee. This has been helpful tonight in terms of pointing out some things that I wasn't aware of, and I think we need to get more informed as a committee about what the issues are and understand them. So that's one, is really understand the context of these problems. And that then leads us to the okay, now that we understand these problems and the scope and depth of these problems, what then might be solutions, and what are other, as you suggested, best practices out there within different municipalities that have similar problems, and how might we be able to think about some of those and begin to kind of look at those. And I think thinking about them on three different levels: on a city level, county level, and state level, you will have a role in at least all three of those. So how might we think about those solutions? Does that sound reasonable, Luke? Certainly feel free to chime in on that one. Mayor, you as well, and Emily, I see you've just gotten on. You're certainly free to throw some ideas there as well. Does that sound like a reasonable solution to understand as much as possible, spend the next maybe couple of meetings to understand the context and be kind of doing our homework, followed by beginning to do more homework and understand some of the best practice success stories, if you will, in terms of dealing with some of these. And these are broad issues, right? These are major issues. So I think it will take us some time just to kind of get our arms around it and then begin to look at those best practices. But at least that begins to steer a path forward for us.
Yeah, Mark, if I may, I think that's a really good idea. I've heard the statistic a lot that a certain percentage of the city is impoverished, but there's a lot I don't know. What does that exactly mean for person to person? Does that include homelessness? Does that include lack of food security? Does that include income? So I think it's a great idea to really kind of do some research on these issues to understand that context, to how our city is specifically in need. And from there, once we have at least a better understanding, probably not nearly as in-depth as our chiefs have, but at least beginning to scratch the surface and really getting a better idea, then I think it might be a little bit more clear about ways that we can go about looking for resources or collaborating with other communities.
Any other thoughts about that direction, how we might proceed?
Well, I have an idea on how the fire department can help, and I'm going to forward you guys some information on what's called a community paramedicine program. So that's basically, we probably have to hire a few more staff, and these people would be going out and servicing the people of our community that can't afford healthcare otherwise. So it would be additional training. They would be advocates for those people. They'd go out and help them with medications, and more on the preventative side of, so we're not having to send an ambulance for them and send them to the hospital. So I was just looking up a good site for that, and I'm gonna share that with you guys here in a couple minutes.
So Chief, can you expand on that a little more in terms of the preventive nature of this? This is folks that actually are going out and working with folks prior to them having an issue that arrives at either one of your desks or your offices. Is that how it is? It's kind of a proactive way of getting out there and working with the different community members?
Yeah, are you familiar with like home health aides and home health care workers? So like a nurse would go into someone's family or into someone's home, and they would help them with their medications and things like that. It's the same kind of concept, except the paramedics would have additional training on top of their regular training, and they would just, and it's a whole list of topics that they can go out and help people under. I mean, I could sit here and read the page after page after page, but I think it would be better just to send it to you guys. And they give examples of actually 3 separate communities, one in New York, that are using this model. And I think it's something in the past that Chief Pigeon pushed for, and I think this could be a good solution to some of our problems if done correctly.
Yeah, Chief Knapp, if you can send that, that'd be great. I'd appreciate reading more about that and understanding that program a little bit more.
Likewise, thank you, Chief.
Yeah, I think that's a great idea. And if we as a committee can sort of help you move that forward, I think that would be something.
I'll tell you, again, this is your committee to run, but I would love to see somebody from the warming station, the actual, hands-on, attend one of these meetings to kind of give them their perspective of what they're seeing.
Yeah, no, thanks, Mayor. That was my thinking, was to, on the backside, Luke, Emily, and I can begin to kind of brainstorm, how we might have the meetings. I'm seeing the meetings as being kind of one part informational and two part kind of strategic planning. And so by bringing folks in to these meetings and asking a lot of questions, we're able to get the context. I think on the backside, we need to be doing a lot more homework than, at least I need to be doing a lot more homework to understand the situation, reading through reports. Certainly Chief Knapp, I'd love to look through that page, those types of things. This way that we can ask really informed questions of our community partners and begin to understand, as Councilmember Murphy said, the specific, the problems and how they impact us very specifically in the city. And that can allow us to begin to think about strategically, how do we move forward and what kind of initiatives might we be able to introduce, or programs that are within, either the fire services or police services. I mean, this seems to be the way to be able to move things, as well as I'm thinking right there about, are there grants available? Could we try to tap into some grants? It might not be, infrastructure might be some of the bigger things people want to spend things on, but, can we use our grants office to help us chase down some opportunities that might help with helping us to support these programs? So that's what I was thinking.
Hi, I wasn't sure if I was supposed to participate in this or not. Can you hear me okay?
Yes, we can.
Okay, but I was kind of curious, is there some way to, for me as a newcomer, to kind of know what we have currently available, what programs we currently have available?
I would say, Emily, this is not you as a newcomer. I think this is me too. So that's exactly what we're trying to do, is try to understand the lay of the land and what we've got, what we're working with here in the city, kind of a resource inventory and a, human capital inventory, and begin to understand this, what we have and the kind of scope of the problem. So I think you're on the money. I think that's exactly what we need to be spending this next couple of meetings doing, is to understand this more and then begin to think about where we move these solutions and what solutions we should be moving forward and how to fund them and how to, what we need to do moving forward on these. So yeah, I agree. I'd like to figure out how to do that. I'll take that one on and reach out to some of the community members I know that work in some of these particular areas and see if we might have, and frankly, I had a student who did a kind of a needs or a resource inventory a couple of years back as an internship with me. I'll reach out to him and get that resource, which might be able to at least give us some good idea. And it's not just the city of Oneonta, but certainly the surrounding area. So I think all of that would be really helpful. And I think anything that anybody else can bring to the table in terms of knowledge about resources and knowledge about problem will just, will only inform our group. So, great idea.
I also want to apologize for being late. That was totally my bad. I had it on my calendar, but I moved it to my work calendar and I was like, oh, it's at 6. So yeah, my bad. It won't happen again.
No need to apologize. I've completely blanked on a council meeting this year. So
okay.
Just to shed some light on resources available in Oneonta, I would like to point out that as far as the county goes, we're the most resource rich and diverse as far as the services available to the community, which is one of the reasons why we end up with a larger population of people that have needs, because they come here to get them serviced. So we have, satellite office, Department of Social Services, mental health services here in Oneonta on Main Street. We've got the Social Security building on Lower Main. We have Salvation Army, the most dense population of religious institutions in the county. So, I mean, there are addiction recovery services, rehabilitation support services, Springbrook. We have Fordu. We have Saturday's Bread and the Lord's Table. or something. Yeah. So, I mean, we are much heavier on resources for people in need than there exist anywhere else in the county.
Mark, if it would be helpful, I'm happy to spend some time doing research on getting some statistics and compiling those and sending them out. Both Marks, I guess this would be, as well as getting together a list of those resources and typing up some summaries. If that would be helpful, I'm happy to do that.
Absolutely. I figured what I would do is coming out of this meeting, try to kind of create a little bit of a kind of homework for the three of us behind the scenes. And so, not to assign anything, but kind of what needs to be done and begin to kind of brainstorm what needs to be done. I think if we have a good understanding of what we need to do, that will inform our process and our meetings. And then we can behind the scenes kind of work on, as you suggested, Luke, whether it's compiling data or Emily compiling the resources or the different organizations that are here. As the chief suggests, as he states, we probably will have a pretty long list that we're going to need to compile. And I haven't even thought, as Chief Witzenberg, you mentioned the religious organizations here, the churches and synagogues, and the role that they might play as well. So I think that's important to consider all of these different resources. But yeah, I'll put that together and send it out to the three of you, and we can begin kind of looking at that. So Mayor Drenick, does it sound like this is shaping into what you kind of had in mind here in terms of where this is moving?
It's exactly going the way I had hoped it might go. And I really appreciate all of you folks for taking this on and for taking it as seriously as you clearly are. So my thanks to everybody.
Well, thanks for the appointment. Looking forward to working with this, and these are some interesting challenges. And if we can make a little bit of headway on some of these issues, I think that'd be, we can really feel pretty good about that. And I think these are important issues to be focusing on.
Yeah, they'll change some lives.
Yeah.
And that's change one life, and it's worth every meeting that we have.
Is there anything obvious that we're missing? Is there any issue sitting out there that we're not addressed? Is there anything that we need to know moving forward that hasn't been discussed?
I think we brushed on it a couple of times, but really this is going to be a resource issue more than anything. The services exist at all levels. Whether or not they're staffed adequately to handle the need is the real question. So there are mechanisms in place for us to help the people that are most in need, but there's people that are much in need that I think a lot of times get passed by because they just don't have that degree of urgency. So, but I'm glad to have local officials that are interested and want to put some elbow grease in, because I think that's going to be important for the long view.
And I would also add that at some point we may want to consider partnering with the colleges, since the students are a significant, percent of our population. And I know that in the meetings I've been in with the college group, mostly around COVID, the whole issue of mental health and mental health resources has absolutely come up. So, again, maybe even being creative and working on grants, we could do something that would also involve them.
Thanks, Doctor. I see them as a really key partner in this for many different levels. I mean, when we're talking about community wellness, we're talking about all community members, and they certainly are the college, and the college students are part of that. And so I think that certainly we need to reach out to them and begin to have those conversations, not to mention that we have a lot of resources there in terms of a lot of different folks that work there and have done research and have ideas. I've been speaking with people on both campuses that have ideas that are floating right around a lot of different issues we're talking about. Most recently, I had talked about someone about homelessness and housing issues and how that they could be addressed in very interesting ways. So I absolutely think that they are key. I mean, again, we have a lot of resources here. It's just tapping in, bringing all these folks together. I feel like that's the role of this committee in part is creating these public discussions and bringing in the right folks to have these discussions. And maybe thinking about how we might connect different groups that are perhaps unconnected. Maybe try to kind of play that pivot role in terms of connecting groups to resources. We do have a community grants office that we have staffed by a fantastic person in Judy Pangman. We're hoping to get her some help here in the next couple of weeks. So, are there ways the city can kind of play that kind of pivot point here and help, kind of make the connections, identify the resources, create some solutions, kind of create a kind of think tank or a kind of problem solving group that we might be able to address some of these is the kind of way I see this whole committee. We might not be actively, lobbying for, we won't have a laundry list of different things on each council meeting, which will be approved by council. I think this will be a committee that will be working behind the scenes, making these connections and developing some things. And so I think that's the role that this plays. At least that's how I see it.
Yeah, so Mark, I couldn't agree more with you. And I'm going to just say that this is my first day on the job, and I feel like I'm going to, when I go home, my wife asks, how was your day? I'm going to say, I had this great success. This committee met and they are right on it. I am really excited about the direction you guys are going.
Well, thanks, Mayor. Again, thanks for the appointment. I think this is exciting committee. I'm looking forward to working with everybody here. I will put together some kind of behind the scenes notes that'll be different from our official kind of minutes of this meeting. So Emily and Luke, I'll send them out to both of you so we can kind of begin thinking about what we need to do and see it as a working document. Certainly, if you got resources that I'm not aware of or something, let me know. The three of us can work together in terms of how we begin to kind of get our arms around this problem or this challenge. I'd like to also then figure out who we want to bring into our first kind of official meeting and invite in. So certainly give me some thinking about that as we begin to craft that agenda. And, I see certainly while I'm quote unquote officially the chair of this committee, this is, we do this together, right? So we work at this together and I'll certainly just facilitate things, but I'm not, you both are, contribute a lot to this and everyone will contribute a lot to this. So together, let's work on this and certainly let me know how what your thoughts are and how you want to proceed on things.
Sounds great.
All right.
Thank you.
Thank
Thank
you.
you.
Well,
Thank you.
unless there's anything else out there, I guess we'll call this meeting, close this meeting. Thank you very much for your attendance. Chiefs, I really appreciate you both kind of giving input on some of those different issues. Appreciate that. Dr. Georgeson, appreciate your insight and we'll certainly value that insight moving forward. Thank you very much.
Thank you too.
Bye-bye.
Thank
Good
you.
night.
Have
Thanks,
a good night.
everybody.